Trevino. I'm with Service Services, and we are your health insurance broker. So we will be presenting the open enrollment changes for Xoriant effective January 1st, 2017. And so this is just the table of contents of what I will be reviewing. So first, I will be going over what is open enrollment, plan year and eligibility, Anthem Medical, Kaiser Medical for California only. There is some plan changes. Anthem Dental, VSP Vision, Anthem Life and AD&D. You have also Anthem Short and Long-Term Disability, as well as voluntary options through Xoriant. And for the flexible spending account, the FSA benefits, there will be a new administrator this year. And then also services, our contact information, we are your new broker this year. So we want you to be able to have access and know how to reach out to us if you need any support regarding your health insurance throughout the year. So what is open enrollment? Open enrollment is the ability to change medical carriers. So if you were on Anthem and you're considering Kaiser, or you were on Kaiser considering Anthem, you do now have the option to make changes to the medical carriers. You also have the ability to add or delete coverage for you and your dependents for children up to age 26. Now is also a good time to update your life beneficiary for your life insurance. And then if no changes are made, we just want you to be aware that you would have to wait until open enrollment to make changes unless you have a qualifying event. So whatever elections you make for this coming year, for January 1st, 2017, you are locked in and you don't have the ability to make changes unless you have that qualifying event. So a qualifying event means you got married, divorced, you had a child, adopted child, your dependent reaches to the age of 26, or you or your dependents lose coverage elsewhere. So for example, if you decide to waive coverage, you feel that you don't need the Xoriant coverage because you have coverage through a spouse's plan, you will not be eligible to come on if you waive unless you have a qualifying event, meaning that your spouse lost coverage to her employer. Okay? So also, as a reminder, again, it's the plan year is January 1st, and you are locked in through December 31st, 2017. The open enrollment period will be from December 1st through December 15th. And you will receive an open enrollment email with instructions on how to log in and elect your coverage for the January 1st, 2017 plan year. So please make sure that you're on the lookout for that email. That is the open enrollment period. All employees must elect coverage in PlanSource or they will be dropped from the coverage for 2017. Your next opportunity to be able to enroll will be effective January 1st, 2018, unless you experience a qualifying event. So again, please make sure that you are on the lookout for that email because you do have to go into PlanSource to re-elect your coverage. So the plan that you had previously available was the Anthem Classic PPO 500 2020. That plan is still available to you. This plan has a $500 deductible if you are single or $1,500 if you have a family. If you look at the coverage out of network, it shows $1,500 for deductible or $4,500 for family. So we always encourage you to stay in network. If you go out of network, you're going to end up paying a lot more money out of your pocket. If you ask the doctor's office, do they take Anthem Blue Cross, they will tell you yes. The important question is to make sure that they have a contract with Anthem Blue Cross. Otherwise, you'll find that you're going to end up paying a lot more money out of your pocket. A lot of times, the admin receptionist who might be scheduling your appointment will not know whether you're contracted, so you always want to either go on to Anthem's website to find a provider, or we can assist you, and I'll go over more details on that in a few of the next slides. The individual out-of-pocket maximum on this plan is $3,500 for a single or $7,000 for family in-network. Again, looking at out-of-network, it is significantly higher, so we encourage you to stay in-network. Out-of-pocket maximum means that if you have a $100,000 bill, the most that you will pay out of your pocket in a calendar year is $3,500. So this is really great coverage. Once you hit the out-of-pocket maximum, Anthem Blue Cross will begin to pay for services at 100% for the rest of the year, and it will reset again in January. If you're sick and not feeling well, you need to go to the doctor. Your office visit copay is $20 copay. Your preventative services in-network are covered at 100%. Again, if you're hospitalized, you will have, so an example, if you're hospitalized, you have a $500 deductible, you would be responsible for 20% of the bill up to the maximum of $3,500. Same thing for surgery. So surgery, same coverage, diagnostic lab and x-ray, you also pay 20% after the $500 deductible. Emergency room copay is $150, but it is waived if you're admitted, and then you have the hospital coverage copays. Mental health and chemical dependency, these are coverages that are covered as any illness. So if you're inpatient for mental health services, it's as if you were in the hospital, 20% after deductible, or if you need to see a specialist for mental health services or chemical dependency, it's a $20 office visit copay. Prescription drugs, in-network, again, looking at out-of-network, you see that you pay a lot more money, so you need to make sure that you are looking for an in-network pharmacy to be able to get the best coverage for your dollars. Generic copay is $15 copay, preferred is $30, and then the non-preferred, which is more of a specialty drug, is at a $50 copay. The next option is the Elements Choice PPO 5900. This plan is actually replacing the Solutions 5000 plan. This is actually a really good plan. This is a good option for individuals who don't go to the doctor that often, who just want to make sure they have some major medical coverage in case you had something major occur. You know, when you think about how many times you probably have gone to the doctor in the past year, some of you never go, some of you may have gone once or twice a year. So this could actually be a good plan because you still get your preventative services covered at 100% on this plan. It does have a high deductible. It's a $5,900 deductible if you're single, $11,800 if you have a family. Again, this is in-network. When you look at out-of-network, it's extremely high, $17,700 individual or $35,400 for a family. The out-of-pocket maximum on this plan is $6,500 for individual, in-network, or $13,000 for a family. So this plan has 3 office visits at a $35 copay. So if you were on this plan, and what happens if you have a 4th office visit, you will then be subject to deductible. So the cost of that office visit could range from $100 to $300. So again, this is a plan if you're somebody who's pretty healthy, who doesn't go to the doctors that often, and you probably won't use more than 3 visits a year. After the $5,900 deductible, if you're hospitalized, the plan then covers everything at 100%. So you'll see hospitalization. There's no charge after the $5,900. Surgery, also no charge after the $5,900. So the copays, if you look at prescription drug copays, there is a $500 deductible for brand name drugs. It maxes at $1,500 for a family. So each family member will have a brand name deductible. For prescriptions for generic, and I'm sorry there's a typo there, it's $5 to $20 copay after the RX deductible for generic. Preferred is $50 copay after the prescription, the RX deductible. And then the non-preferred is $65 after the RX deductible. And again, if you see out-of-network, applicable copays are apply, and then 50%. So again, stay in-network for your pharmacy. Online tools for Anthem members. So if you are on Anthem, there is a great website available to assist you with completing a health assessment test. They also have where they would provide your own personal health report, summary report. They have a 24/7 online support via Live Health Online. So if you are traveling and you're not feeling well, you need to call like an advice nurse, this is the online support that you can reach out to. If you are a California employee, you would register at the www.anthem.com/CA. If you are a employee outside of California, you would just go to anthem.com and you would access the Blue Card Network. So the Blue Card Network is great, so especially if you're somebody who doesn't live in California, you actually have a great network. Anthem Blue Cross uses both Blue Cross and Blue Shield outside of California, so you have a very large network if you need services outside of California. Your next option is a Kaiser HMO $30 copay. So this plan is a change from last year when we worked with your management to determine the best plan options. We decided to make this change to go to a $30 copay. rather than having significant increases out of your paycheck for payroll deductions. So this is actually lower in cost. And so being able to keep the costs down for you out of your paycheck, when you think about how many times you probably go to the doctor a year, just made better financial sense for the employees to have a higher office visit copay than more deduction out of your paycheck than what that cost would have been to stay on the plan. So this plan has no deductible. Your individual out-of-pocket maximum on this plan is $2,000 for a single, $4,000 for a family. So again, worst case scenario, you have that $100,000 bill. The most you're going to pay on this plan is $2,000 for the calendar year. Kaiser will pay for all services at 100% for the rest of the year, and then it does reset again in January. Your office visit copay is a $30 copay to see a physician as well as a specialist. Your preventative services are covered at 100%. Hospital copay is a $250 copay, which is the same as what you had previously. Outpatient surgery is also a $100 copay. Your lab, x-rays, any advanced imaging are still also a $10 copay. Emergency room, there is a $100 copay, but it's waived if you're admitted. And then the mental health and chemical dependency, again, is covered as any illness, so hospital and office visit copays apply. For your prescription drugs, there's no deductible. For generic prescriptions, a $15 copay, and then for preferred brand is a $30 copay. Kaiser also has a great website, so you can register on the kp.org website. This actually gives you the ability to email your doctor. So this also saves you time and money. So if you don't want to, go see your doctor, you can actually email your doctor, and that would eliminate your time of having to go in to see a physician and eliminate having to pay copays. You can view lab results on the kp.org website. You can make appointments. Kaiser is really advanced in technology. They also, you can also schedule phone appointments. They have live healthy online tools, wellness coaching and classes, online health assessment. Kaiser is one of the biggest carriers that tries to help with healthier lifestyle and and wellness. And so, of course, those types of things also keep your healthcare costs down. So, I encourage you to go to kp.org and register and be able to find a provider as well as schedule appointments. So your dental option is going to remain with Anthem as well. So it's a PPO dental plan. Your annual maximum is a $1,500 maximum. This is, again, calendar year. And it is per person, so each person in your family would have a $1,500 benefit. It goes from January to December. And then there is a deductible. So the deductible is $50 for individuals, but it maxes out at 3 times your family, so it doesn't go to more than $150. So, for example, you had a family of 5, you will only pay 3 deductibles for your family, but it is waived for preventative services. So preventative services are covered at 100%. However, if you look at out-of-network, it is paid at a usual, customary, and reasonable based on the dentists that are in your geographical area. So what that means is if you were to go get your preventative services with a provider that is not contracted with Anthem, you would get a balanced bill. So if you're in network and you're getting your preventative services, so your cleanings, your x-rays, you would not get a balanced bill. That bill will truly be covered at 100%. Out of network, you will get basically an excess charge, and that's because there's no discounts out of network. So again, just to help encourage you to pay less money out of your pocket, encourage you to stay in network. Basic services are covered at 80% as well, and that's for your fillings, your deep gum cleanings, root canals are covered at 80%. Major services, so those are like your crowns, bridges, inlays, those are covered at 50%. And orthodontia is 50% for child only, up to maximum of $1,500. We also provide the benefit books that will have more detailed information. So if you have more questions in regards to the benefits on the dental, you will have access to more details as well. VSP is not changing as well. You will continue to have your coverage with VSP. The frequency is you get 1 exam every 12 months. Lenses are also covered every 12 months. And then frames, you have coverage every 24 months. So for your exam, $20 copay in network. If you look at out-of-network, it shows a $50 allowance. So what that means is if you were to go out-of-network, go to a provider that's not contracted with VSP, you would pay out of pocket, submit your receipt, and then VSP would reimburse you up to these allowed amounts out-of-network. So again, to help keep your costs down, I encourage you to stay in-network. Your exam in-network is a $20 copay. Prescription glasses is a $25 copay. Your lenses are covered in full in-network, where out-of-network you see the allowed amounts of $50 to $100. And then your frames, the allowance is VSP will cover $130 for your frames, plus you get a 20% discount off the balance. So what that means is if you wanted some frames that cost like $200, VSP will cover $130, and then you get 20% off the remaining $70. So you do get a discount off the over the allowed amount. Lenses are also at a copay, so you'll see the copay for your lenses. Contacts, you do have the ability to get contacts. It's up to a $60 copay, but they allow up to $130. And so what that means is it's in lieu of your frame, so you can get both. So either you get the lens, you either get the frames or you get the contacts. And I apologize, so up on the top, those are lens enhancements that you have copays. So you have progressive, standard, premium, progressive. Also, those are at copays. And then again, if you look at out-of-network, you pay more out-of-network. Okay, so for the life insurance, this is covered and sponsored by Xoriant to the staff employees at no cost to you. The benefit pays upon the death of an insured it's for the employee coverage only. It covers 2 times the earnings to a maximum of $750,000, so it would be based on your earnings. And then there is accidental death and dismemberment benefit that also pays 2 times the earnings. So what that means is if you were to pass away in an accident, your beneficiary actually would receive 4 times your earnings, and it's based on your salary. It is guarantee issue up to $475,000. So what that means is there's no questions, no medical questionnaires. You basically have that coverage guaranteed, even if you had any major health conditions. You also have short-term disability that is employer paid, and this is an income replacement if you were disabled for a benefit duration of 18 weeks. And what this does is it covers 60% of your monthly earnings to a maximum monthly benefit of $2,310 a week. So there is a 60-day elimination period, so you would have to be disabled for 60 days before the short-term disability coverage kicks in. You also have employer paid benefit, also sponsored by Xoriant, is your Anthem long-term disability. This is also an income replacement. This actually would cover you after you've been disabled for 180 days, and this covers 60% of your monthly earnings to maximum monthly benefit of $10,000. And the benefit duration is to age 65, which is Social Security's normal retirement age. Also, you have a Anthem Resource Advisor coverage, which is similar to an EAP. And this program helps give support for family private access to work-life resources. And there's no additional cost to you. This is also paid for by Xoriant. You have 24/7 access. These are phone consultations, referrals from anywhere in the United States, and unlimited access online as well. And so the types of services that this would help with are counseling sessions for qualifying events, identity theft, victim recovery services, legal and financial consultations, and you also can access the benefits by calling the 100 number. You have a voluntary life and AD&D insurance, so if you wish to purchase more insurance than what is already provided for you by Xoriant, you can actually purchase more coverage. The nice thing about the voluntary coverage through Xoriant is that it's also a guarantee issue. So if you're somebody that has a major medical illness or you have a loved one that has a major medical illness, this gives you the ability to get coverage at a guarantee issue. So the guarantee issue for an employee is $150,000. The guarantee issue on this plan for a spouse is $50,000, and then for children it's $1,000, $5,000, or $10,000. So the amounts are greater. The amounts cannot be greater than the spouse's coverage, and these coverages are portable. So if you're no longer with the company, you do have the option to keep this coverage as well. the spouse's amount cannot exceed 50% of your election as an employee. So what that means is if you decided that you wanted $100,000, your spouse's coverage can't be more than $50,000. Also is a voluntary accident insurance. These are employee paid options. So this is coverage for off-the-job accidents only. It pays fixed benefits for specific injuries, procedures, or death as a result of a covered accident. It includes benefits for hospitalization, fractures, dislocations, emergency room visits, and more. There's no health questionnaires. There's pre-existing condition limitations. And then also it pays directly to you. The really nice, one of the nice features about this plan is that there is a $50 wellness benefit each year. So if you are on this plan and you go get your annual checkup, you submit the form and you'll get reimbursed $50 from Xoriant for going and getting your annual checkup. And this is also coverage that is portable. So if you're no longer with the company, you have the option to continue it outside on an individual basis. There's also a short and long-term disability insurance. So this is just giving you more options to purchase more coverage, even though you already have employer paid coverage. So if you were disabled, you do have the option to purchase more insurance to help cover, a situation where your paycheck will be reduced because you're on a disability income. So you have more options through Xoriant as well. So they offer short and long-term disability. Also, you have a voluntary critical illness. So this covers for if illnesses such as heart attack, heart failure, stroke, coronary bypass surgery, end-stage kidney disease, occupational HIV, hepatitis. An example, I had a loved one that was in ICU for 2 months, and this benefit paid me $7,000, which helped when you have a loved one that is, critically ill. When you think about the expenses that you incur, whether it's, having to take time off work or having a loved one down, less income, these types of this type of coverage is very helpful. Another change this year is going to be the flexible spending account administrator. So the new administrator will be the Advantage Group, and you do have the option to elect the healthcare FSA as well as dependent care FSA. And so the change for 2017 as well is that the increased annual maximum is $2,600. So that's effective January 1st, 2017. And the FSA helps pay for qualified medical expenses pre-tax. And I'll go over more details on that, but this is to help if you know you're going to have some major medical services throughout the year and you want to set aside pre-tax dollars. Dependent care FSA also is available to you. This allows you to contribute pre-tax dollars to help pay for qualified dependent care, and the maximum to contribute each year is $5,000 or $2,500 if you're married and filing separately. So TAG is the abbreviation for the Advantage Group, so you'll see that often. So this is information about the flexible spending account. So your annual maximum, the minimum you can contribute annually is $100 for medical or dependent care. And then again, the maximum is $2,600 for medical, and then dependent care is $5,000. Parking, you also have the ability to set aside pre-tax dollars for parking in transit, which is $255 maximum monthly. The maximum rollover for the FSA is $500, and it can be carried over for the next year. So what this does is allows you to determine if you don't have any major medical expenses, but you want to still contribute to the FSA just in case something occurs throughout the year. $500 is a good amount to contribute towards the FSA, because if you don't use it, it does roll over. The flexible spending account is a use it or lose it benefit. So if you don't use it within the year, you will lose it. So $500 is the only amount that you will not lose. So if you were to leave the company, you do not have the option to take those funds with you. It will be an option on COBRA, but you don't get to keep those funds. The funds will remain with the company if you don't use your FSA funds. And then, so here's an example of why the FSA is a great option when you're using pre-tax dollars. So here's an example of a weekly earning. So you'll see that without the FSA, the $400 paycheck, no FSA contributions, you get taxed on your FSA, on your weekly earnings, and then you look at what your net take-home pay is. Your eligible expenses you ended up paying out of your pocket after taxes. But those services that are pre-tax, so like if you need to get dental work done, you have prescription glasses, you have co-pays and deductibles, you're going to have a surgery, you know, those amounts you'll want to set aside pre-tax, and then you actually pay less that amount. So here they're using the FSA contribution as $110. So you actually will get taxed on $290 instead of $400, and then you still get to pay for your services. And the flexible spending account does provide you with a debit card, so you will pay for those funds using your debit card. But basically, this is just helping you to pay for any of those healthcare expenses prior to being taxed. So real importantly, I just want to make sure that you're aware that all employees must elect coverage in PlanSource, or they will be dropped from the coverage for 2017 and will not be able to enroll again until open enrollment next year, effective January 1st, 2018, unless you experience a qualifying event. Also to let you know, so for the PlanSource portal, we are working with PlanSource to make sure that the portal is open for you effective December 1st. And so you will get an email notification. Just need to remind you that once you get that email notification, please make sure you register, log in, and elect your coverage for 2017. Also want to provide you with our contact information. So we have provided wallet cards as well as benefit cards, and then you will have access to this recorded webinar just to make sure that you have our contact information if you ever need support throughout the year. We have a 800 phone number. We have a service email address, which is the mybenefits@ensor.com, or you have direct contacts. Christina Calvetti is the account manager, and Lisa Pham, our customer service associate, is available to help with any questions if you want a direct contact. The types of services that we help with is if you have questions about your coverage throughout the year, you lose your ID card, you have bills from the carriers that didn't get paid and you don't know why. We have direct contacts with the insurance carriers, and we have the ability to help bring resolution to any of the issues that you might be having or experiencing with your coverage. So we do encourage you to contact us. You don't want to be going to your employer with all your personal privacy health issues, so it's better that you reach out to us directly. Again, we're here to support you, and we encourage you to reach out to us. But that concludes our session, and I thank you for your time.